Hi Chris, my name's Kat. I'm a massage therapy student here at Durham College, and today I will be performing an assessment on you, which will include palpating your posterior tibial pulse, doing some ranges of motion on your knee, and performing 3 different special orthopedic tests. Me doing this assessment benefits you by helping me diagnose to see if there's any impingements or any issues going on with your joints and muscles. You might feel slight pain. At any time, you're more than welcome to ask me to stop, and I will do so. Do you have any questions?
No.
And then do I have consent to touch?
Yes.
Wonderful. So first I'll be starting with the posterior tibial pulse, which is working distal down the tibia from the knee. And the posterior tibial pulse is posterior and inferior to the medial malleolus. And there we have the posterior tibial pulse. So next we will be doing range of motion on the knee. So first we're doing active, so if I can actually just get you to lie down on the table.
This way or?
Doesn't matter, whatever way you're more comfortable, I just need you to lie down.
Okay.
Great. So to start, we're doing active, so I'm just going to instruct you how to move your leg, and I'll be applying a little bit of overpressure. So first we will be doing active knee flexion. So if you just want to bring your heel upwards, closer to your thigh, like such. And is there any pain?
No.
Wonderful. Now we will be doing active extension. So just if you want to drag your foot to the edge of the table, like so. And again, putting a little bit of overpressure on that. Is there any pain at all?
Nope, no pain.
Wonderful. Next, we are doing passive range of motion. So I don't want you to help me at all, but please let me know at any time if there's any pain or uncomfortableness. So first, we are doing knee flexion, which is a tissue approximation end feel. We are doing knee extension, which is a bone-to-bone end feel. And then we are doing knee internal and external rotation. So in order to do this, we are putting the knee into 90 degrees. And I'm grasping it just at the patella and then rotating inwards, like so. And then rotating outwards, like so. Is there any discomfort at all, Chris?
No.
Wonderful. To finish off the range of motion, I will be doing resisted. In order to do this, I am putting the pillow underneath Chris's leg just to ensure that the knee isn't fully extended. And so for resisted, I just want you to match my pressure. So first we will be doing resisted extension. So if you just on my count want to resist, 1, 2, 3, release. 1, 2, 3, release, and then once more. 1, 2, 3, release. Wonderful. And how are you feeling?
Still okay.
Great. So if we just did knee extension, now we will be doing resisted knee flexion. So at my count, if you just want to resist my hand, 1, 2, 3, release. 1, 2, 3, release, and then 1, 2, 3, release. Any discomfort?
No.
Wonderful. I'm just going to remove the pillow. Okay, so now we're moving on to the special orthopedic test. First, we will be doing the anterior drawer on the ankle, which tests for increased laxity in the talofibular ligament. So I'm just bringing your knee up as such. And then to do that, I will be grasping the calcaneus like so, and then putting pressure onto the tibula rather, like this. Is there any pain?
No.
Okay, so Chris has a negative result for the anterior drawer of the ankle. A positive result would be pain or increased laxity. Next, I will be doing McMurray's. So for that, I am, if you can pause it, hit the
There, you're
pause
good.
button. Okay, so Chris, now we will be performing the McMurray's test, which tests for meniscus tears. So first, I am just bringing the knee and hip into 90 degrees flexion, and I'm putting pressure on the lateral condyle of the femur, and then I am putting a valgus force. Is there any pain?
Nope.
Wonderful. Okay, and then again, I am putting pressure on the lateral condyle, and then I am doing, sorry, the one before was a valrus force. Now I'm doing valgus force and extending the knee. Is there any pain?
Nope.
Wonderful. So Chris has a negative result. A positive result would be clicking, cracking, or provocation of pain. Finally, we are doing the Finkelstein's test. So Chris, if I could just get you to sit up on the table. Wonderful. Now, Finkelstein tests for de Quervain's tendinosynovitis. So in order to do this, Chris, I'm just going to get you to extend your arms like so, and then opposition of the thumb, just like that. Flex your fingers closed, and then perform ulnar deviation. Is there any pain?
Yeah, a little more on the left thumb.
Okay, so so Chris does have a positive result. You can stop now. So if he didn't have pain, I would just put a little bit more of overpressure. But since he does have pain, it is a positive result of de Quervain's tendinosynovitis. And that concludes my assessment, Chris. Thank you so much.